Good afternoon, Evan Cage. I am Mihiraa. Let's start the warm-up session. Who has been a role model for you in your nursing career?
Throughout my career, I have been fortunate to work alongside several exceptional nurses who have inspired me with their compassion, expertise, and dedication to patient care. One nurse, in particular, stands out as a role model for me. She consistently demonstrated exemplary clinical skills, effective communication, and a genuine passion for advocating for patients' well-being. I learned valuable lessons from her about the importance of patient-centered care, empathy, and teamwork, which have greatly influenced my own practice and approach to nursing.
Currently, what are some of the most exciting advancements or innovations in healthcare?
There are many exciting advancements and innovations happening in healthcare and nursing today that have the potential to revolutionize patient care. One area that I find particularly fascinating is the integration of technology into healthcare delivery, such as telemedicine, electronic health records, and wearable devices. These advancements have the potential to improve access to care, enhance communication among healthcare providers, and empower patients to take control of their health.
How do you prioritize patient care tasks when you have multiple patients with competing needs?
Prioritizing patient care tasks is essential in nursing. I typically assess the acuity of each patient's condition and prioritize tasks based on the urgency of their needs. For example, I would address critical or time-sensitive interventions first, such as administering medications or responding to emergencies. I also delegate tasks appropriately and communicate with the healthcare team to ensure that all patients receive timely and high-quality care.
Can you describe a time when you had to adapt to a sudden change in patient condition or care plan?
As a nurse, I understand the importance of being flexible and adaptable in dynamic healthcare environments. In a recent situation, I had a patient whose condition unexpectedly deteriorated, requiring immediate intervention. I quickly assessed the situation, notified the healthcare team, and implemented appropriate interventions to stabilize the patient. I remained calm under pressure, communicated effectively with the team, and adjusted the care plan as needed to meet the patient's evolving needs.
How do you ensure patient safety and prevent medical errors in your practice?
Patient safety is my top priority as a nurse. To prevent medical errors, I adhere to established protocols and best practices, such as double-checking medications before administration and verifying patient identifiers. I also maintain clear and accurate documentation to ensure continuity of care and communication among healthcare providers. Additionally, I advocate for patients' rights and actively participate in quality improvement initiatives to identify and address potential safety concerns within the healthcare setting.
You can now start the role play.
Good morning, Mihiraa. It's good to see you looking better. I have some good news for you. Your recovery has been satisfactory, and you're ready to be discharged. I'm here to give you some instructions before you leave. How are you feeling overall?
Yes, thank you. I'm definitely feeling a lot better than when I first came in. I still have a bit of pain, but it's nothing like before.
That's good to hear. It's completely normal to experience some pain, especially considering what you've been through. It sounds like you're ready to head home and continue your recovery there. Let's discuss what steps you need to take to ensure you're taking good care of yourself.
Okay, sounds good.
Let's discuss your post-discharge care plan to ensure a smooth continuation of your recovery at home. First, we'll address wound care. Mihiraa, it's crucial to keep the area clean and dry, following any specific instructions provided by your doctor regarding dressing changes. Next, maintaining a nutritious diet and staying hydrated will support your body's healing process. Make sure to eat well-balanced meals and drink plenty of fluids. Continuing your antibiotic treatment as prescribed is essential for better healing. Please be mindful of taking your medication exactly as directed. In addition to physical care, it's important to be cautious at home. Always check for any signs of infection, such as increased pain, redness, or swelling around the wound. And Mihiraa, remember to attend the scheduled follow-up appointment with your doctor to monitor your progress. We're here to support you every step of the way, so please don't hesitate to reach out if you have any questions or concerns.
Nurse, I'm a bit worried about taking antibiotics for too long. Won't that cause other issues?
I understand your concern about taking antibiotics for an extended period. Let me assure you that, while prolonged antibiotic use can sometimes lead to other issues, in your case, it's essential for your recovery. Antibiotics are crucial for preventing the spread and recurrence of infection in your body. By completing the full course of antibiotics as prescribed, you're ensuring that all the bacteria are eradicated, reducing the risk of the infection coming back. Mihiraa, do you have any specific concerns or questions?
Yes, I am worried. Every medication has some sort of side effect, and antibiotics are no exception. If I have to take them for an extended period, I'm concerned about the potential adverse effects on my health from these side effects.
I acknowledge your concern about potential side effects from taking antibiotics for an extended period. However, Mihiraa, it's important to note that you haven't experienced any side effects so far, which is a positive sign. Even if you were to experience any side effects, they are usually manageable and shouldn't have a significant impact on your overall health. Some possible side effects of antibiotics may include mild stomach upset or occasional sleep disturbances. However, these side effects are generally temporary and can be easily managed with simple measures like taking the medication with food or adjusting the timing of your doses.
Yes, it might be. But if I'm not taking them, I don't want to have to worry about potential side effects. Besides, even if my healing process gets delayed, I believe it won't have any adverse effects on my body.
I understand your hesitation, but Mihiraa, it's important to consider the potential risks of not continuing your antibiotic treatment. Without completing the full course of antibiotics, there's a risk that the infection could worsen, leading to more severe complications. In some cases, this may even require invasive procedures or hospitalization to treat. By continuing with your antibiotic treatment as prescribed, you're taking proactive steps to ensure that the infection is fully eradicated and your body can heal properly. Mihiraa, it's important to consider that the benefits of continuing your antibiotic treatment far outweigh any potential side effects. I hope you now understand the necessity of continuing with your antibiotic treatment. Mihiraa, would you be willing to continue with your antibiotic treatment to minimize the risk of complications and promote your recovery?
Yes, I understand now. I'll make sure to finish the full course of antibiotics as prescribed.
That's fantastic to hear, Mihiraa. If you have any further questions or concerns, don't hesitate to reach out to your doctor or come back for a follow-up appointment. Take care, and I wish you a speedy recovery.